our eighth town hall meeting for Shenango Forks and looking at potential retiree options. As Joe said, my name is Ed Vaughn. I am from the ENV Insurance Agency, and I've got Cindy Wise from Humana online and Kristen Wall from my office. A quick introduction to ENV. We are a 32-year-old benefit consulting firm that has a little over 30 employees, and we currently work with 130 school districts in New York State. And then what we do is we do this kind of analysis work for all these different schools. So today we're going to go through a short PowerPoint presentation and review the analysis that we did for the district. We're asking that everybody hold your questions till the end, and we'll make sure we answer all the questions the best that we can. And also at the end, if anybody wants to email me your name and phone number with any specific information, we can have Humana and Aetna get back to you with those answers. So, but before I get into the PowerPoint presentation, I want to address three questions that kind of came up by a lot of people early in this work. The first question was, we're in the middle of a pandemic. Why are we having this conversation now? And why is this not put off? And I don't think anybody would disagree that the timing's bad for everybody. However, districts are faced with trying to balance their budget, and they've got to get their budgets numbered. Even though the vote got moved to June, they still have to get their ducks in a row. I understand that the aid numbers just came out, and they're low for a lot of school districts. And this year they can make quarterly adjustments, which is another obstacle that districts are going to have to really figure out how to put in their budget. Shenango Forks is not the only district that's looking to make this move at this time. I think I've mentioned in previous meetings that Canajoharie is looking for 7/1. Madrid-Waddington is looking for a 7/1 effective date. Harpersville moved 4/1, and Owego also moved 4/1. The earliest date that Forks could make this move, if they decide to do this, would be 7/1. So that's the first question. Second question is, why are we using a consultant versus talking to the carriers direct? And that's really threefold. The first thing is, not all carriers will work with clients direct. Some will only work with consultants. The second thing is the rates are the same. There is no discount on the rates, whether somebody uses a consultant or not. And the third thing is that a carrier like Excelis or Humana or Aetna can only talk to you about themselves. They cannot talk to you about what any other carrier is doing. And a consultant can put together a comparison like we've done to compare the good, bad, and the ugly about all the carriers to help you better make a decision on what plan is better for the district. The fourth thing I added in there, which I think is probably one of the most important, is at ENV, we have a call center. We're here to service you and be your advocate. We don't work for any insurance carriers. We don't work for Excelis or Humana or Aetna. We work for you. So we're here to help you with any questions and any issues. And all the carriers have call centers as well. But what we found over the years is you get put into what I call the 1-800 shuffle or a black hole potentially. Plus, I don't think people a lot of times understand insurance. So they're not always sure what to ask or how to ask it. Our people have been in our call center here for years and can help those people with any issue that pops up. The third question is, if it's too good to be true, then it usually is, how do these carriers say that they can give us as good or better coverage and then provide us with such a huge substantial savings? And that's threefold as well. The first answer to that is that currently, right now, Medicare is your primary carrier and Excelis is your secondary carrier. Medicare pays 80% of all your claims, but the district is being charged as if Excelis is paying all your claims. That's a huge difference. The other difference is on a Medicare plan, all retirees post 65 would be considered single coverages. Husband and wife would be two singles. Under the existing Excelis plan, a husband and wife would be considered a family, and the rate factor is 2.5 times. So instead of taking a single rate and multiplying times 2, like you would do on the Medicare plans, you take the single rate, multiply times 2.5 on the Excelis plan to get a family rate. So we're being overcharged for those two people. The other answer to that is that that Medicare is paying these companies, these Medicare Advantage companies, to provide better services and better benefits than Medicare does. So they provide them with a large a subsidy to make sure that happens. So between the subsidies and the differential between the 2.5 and 2, and then also between the 80%, that's why we have these big differences. And if you notice, or you will notice when we look at the analysis, it's not just one carrier that came in low. I mean, all three carriers here have a substantial amount of money that the district could save by considering this option. So with that said, we get into our PowerPoint presentation, and the first part of it really just talks about Medicare, just trying to give people some general Medicare background. So as I go down through this, they can understand the differences between what we're talking about. You know, the first thing on the page is Medicare supplemental policies, and they cover some or all of the out-of-pocket expenses that original Medicare does not cover, because Medicare does not cover the Part A or Part B deductible. But the Medicare sub policy does. They cover deductibles and co-insurance. So retirees on a Medicare sub policy would not have deductibles or co-insurances to have to meet. There usually is a separate ID card for the Part B program, which is the prescription side of it. With the Medicare sub policy, you typically have 3 ID cards: a Medicare card, a Medicare sub card, and a prescription drug card. And then effective January of 2020, the Plan F, and the reason I use Plan F is because it's 100% coverage. Medicare labels all their plans between A through, I believe, J, and Plan F is 100% coverage. And so effective January 2020, anybody that was 65 years old prior to January 20 could remain on a Plan F policy, and anybody that turned 65 after January 1st, 2020 would have to go to Plan G. The only difference between Plan F and G is Plan G does not cover the Part B deductible, which is $198. Under the Medicare Advantage plan, they provide Medicare coverages through a private insurance company all under one umbrella. So it includes the Part A and the B benefits and the Part D, which is prescriptions. All of the out-of-pocket expenses under Medicare Advantage plan are all basically customized based on the planned benefits that you have in place currently. And then you have one ID card for all benefits. The last end of this page says Medicare plans and networks are relevant. I've talked about this at every meeting several times. Under the current existing Excellus plan, we have a network, people that belong to the Excellus network. And under the Medicare Advantage plans, the Medicare sub-plans, it's no longer are they part of a network. It is, do they accept Medicare, or do they do Medicare assignment? And what I've already talked about in other plans or other meetings is 98% of all providers in the country either accept Medicare or do Medicare assignment. Under the Excellus plan, we currently have 98% of the providers in our 31 counties participate with Excellus, but on a national level, only 80% of the providers participate with the Blue Cross Blue Shield plans. So we have this passive network. I think that in the last meeting, somebody brought that up. They had spoken to a hospital and they said they weren't part of a Humanis network. However, they did accept their passive plans. And that's what these plans are. These passive plans mean that a provider does not have to be part of the network to be considered as part of the program. Also, retirees don't have to worry about doing anything with billing. We get into 2 more pages down, Joe, the frequently asked questions. 1 more, yep. This is some of the questions that I typically go through before I get into my presentation. The first one always is, what is the difference between a Medicare Sup and a Medicare Advantage plan, which we've already gone through. What I want to point out here in this part of the presentation is that under the Medicare Advantage plans, they rate carriers with a star rating, and under Aetna and Humana, they're both currently rated 4.5 out of 5 stars. It did get asked at the last meeting, what is Excellus rated? They don't rate Excellus, they don't rate Medicare supplemental policies like they do Medicare Advantage plans. Excellus as a company is very highly rated. They are a very good company. Next question was, will I have to switch a doctor? The answer is typically no. As long as your provider accepts Medicare or Medicare assignment, you will not have to switch. As we talked about a few minutes ago, 98% of the providers nationally will accept Medicare in some form. How are claims processed? Under a Medicare supplemental policy, claims go through Medicare first and then are processed through the Medicare supplemental policy after that. Under the Medicare Advantage policy, claims are submitted to the carrier directly, and that's all. What tier are my prescriptions on? We're not looking to make any prescription changes on your tiers. Most people at Shenango Forks have what we call a 210 drug card, which means they pay $2 for generic drugs and $10 for name brand drugs. That won't change. There is a PPO plan that's there with a 51530. I believe 6 people have that in place, and that will not change as well. What I do want to talk about is that tiers do change. Drugs do change tiers, whether it's Excellus currently, whether it's Excellus Medicare Sup, United Healthcare, all carriers have the right to change their tiers, and they typically in the industry, they do it quarterly. However, we found out with the Medicare Advantage policies, if a drug cost is going to go down in copay cost, they can make the change anytime. And if it's going to go up in cost, they typically do it in January 1st. But the industry standard is typically quarterly. Is there a donut hole? The answer is no. You only find a donut hole in the individual policies that you would see that just somebody purchased off the street or through a TV commercial or an ad in a magazine. A donut hole is gap in prescription coverage. And under the group policies that we're talking about today, you do not have to have any concern about a donut hole. Is there any pre-existing condition clauses to be concerned about? The answer is no. No matter what you're being treated for, whether it be a heart issue or a cancer issue or diabetes or whatever, there is no pre-existing condition clause to worry about. What happens if my spouse is over 65 as well? If your spouse is over 65 as well, they would go onto the Medicare plan just like yourself. Which goes to the next question, what happens if my is under 65 and I'm over? The coverage typically follows the employee or the retiree. So if the retiree is over 65, they would go to the Medicare plan, and the spouse would stay on the active plan until they turn 65, and then they would go over then. Do I need to be enrolled in Part A or Part B? The answer is yes. Just like today, you need to be enrolled in Part A and Part B under Medicare. What happens if I have any questions or problems? And the answer to that question is you can use the ENV call center. You've got our number there and our website address there. Any of the retirees that have our programs can call our call center and ask the questions or talk about their issue, and then we'll take care of them. We're here to be your advocate. We don't work for any of the insurance companies. We work for you folks. So it's very important you know that we're here to help you through any questions or issues that may arise. The last page is just a list of the school districts that we've put some Medicare programs in the southern tier and in the central New York area. And I want to just point out that under Shenango Valley did not put all their retirees in. I believe their teachers did not move over, and everybody else did. The other thing I want to mention is Johnson City, who's not on this list. Johnson City did move to Humana about 4 years ago. And they've been with Humana ever since. And I really bring this slide up just to talk about, that Shenango Forks is not the first district to do this. They're not the guinea pig. This is something that's been done for years and years. As I mentioned in my other meetings, all the districts that I've ever worked with that have gone to a Medicare program, not one of them have moved off the Medicare programs. They're all still with them, and they're all continuing to do well and save the retirees and the district's money. And that's the end of the brief PowerPoint presentation. And as Joe is putting the other presentation up, I want to just make a couple of quick announcements. 2 things. We did update the analysis. I'm going to talk about the analysis today that's in front of you that Joe put up, but we did put a more updated analysis to the district, which is on the website, which highlights the upgrades that Humana made. So you can see those. I'll address those in my presentation today. And also, we tracked all the questions. So all the questions from the previous meetings were logged and answered, and we sent that back to the district as well. And those are on the website as well to be reviewed. So you'll be able to see those. I think Joe is putting it up right now where they are. So again, as we get into this analysis, we're going to go down through this. It's pretty detailed. And, let's hold the questions for the end, and then we'll open it up at the end here to answer questions. Or we can, as I said before, you can send me your name and number. We can have Humana contact you for any specific information you want to make sure how something's covered. So we look at this analysis. The way this is done is it's on the left-hand side is the Excellus Blue Cross Classic Blue plan, which most people are on at Shenango Forks. To the right of that is the PPO plan, which I believe there's 6 people on. To the right of that is the Medicare benefit structure, and then we have the Excellus Medicare program. And then in the shaded areas, you'll see whether something's going to be a plus, minus, or equal sign, which just means, is this coverage as good as what I have in place now, or is it less than? And I've got Humana, and I've got Aetna, and I have the same kind of analysis done on their benefits as well. So we'll go down through this here and show how this works. So the first thing I talk about is a deductible. The deductible on the Classic Blue is $50 for an individual and $150 for family. There is no deductible under the PPO plan. Under the Medicare, you can see Medicare does have a deductible for Part A and Part B. However, under the Medicare supplemental policy, they cover that deductible, so the retirees would have no deductibles they've got to meet. Under Humana and Aetna, there are no deductibles a retiree would have to meet, so those benefits are going to be as good or better than what we have in place currently. Standard copayment. Under the Excellus plan, you don't have copayments other than prescriptions. You do have co-insurance, which we'll talk about in a second. The PPO plan is a $10 copay. Under the Excellus Medicare program, no copays as well. You'll see it'll say 100% coverage after Medicare. Under Humana and under Aetna, they've got copays, but they're zero. So when it says zero copay, that means you'll pay zero at the time of service for that specific category. Standard co-insurance, 20%. That means after the deductible, you pay 20%, and Excellus pays 80% until you reach your out-of-pocket maximum of $400 for an individual and $1,200 for family. Under the PPO plan, it doesn't apply. Under the Excellus Medicare plan, same thing. If the co-insurance is covered by the MedSup policy, and the out-of-pocket plan, out-of-pocket expense really doesn't apply there. And with Humana and Aetna, same thing. It doesn't apply because there are no co-insurances or out-of-pockets to be worried about. So that benefit section right there is going to be as good as what we have in place today. Lifetime max benefit is unlimited benefits across the board. Nobody has deviated from that. It's all the same coverage. Under office visits, the office visit is subject to deductible and co-insurance under the Classic Blue. Under the PPO plan, it's a $10 copay. Under Excellus Medicare, you can see it's 100% coverage after Medicare. And you can see under Humana, that's a zero copay. So the benefits are going to be the same. Chiropractic care, currently subject to deductible and co-insurance under the Classic Blue and under the PPO, a $10 copay. And for those plans, it's for spinal manipulation only. Under the Excellus Medicare plan, it's the same thing. It's covered 100%, but for spinal manipulation. Under the Humana and Aetna programs, they covered 100% as well, but they also add routine maintenance coverage covered with a zero copay. So that's one of your first enhancements here in this analysis. The next category section is wellness, and you can see that routine physicals, adult immunizations, mammography screenings, pap smears, prostate cancer screenings, and bone density testing is all currently paid 100% by both plans. And under the Excellus Medicare plan and under the Aetna and Humana plan, they are also covered 100%, either with zero copays or 100% coverage after Medicare. Next page. Next page, we get into routine vision. Routine vision exams are not covered under the Excellus plans. They're not covered under the Excellus Medicare plan. Under the Humana plan, under this analysis, it says it's not covered, but this is an upgrade that Humana made, so it is now covered with a zero copay, one annual exam every 12 months, just like Aetna is. So that's another enhanced benefit, and that is reflected on the new update that we gave the district. Eyewear for our frames and lenses, currently under the Excellus plans, they're covered for a pair of cataract, or after cataract surgery, they cover a pair of glasses to take care of part of that surgery. Under the Excellus Medicare program, the same thing. They cover 100% of the glasses, but it's only after a cataract surgery, so it's the same. With Humana and Aetna, they have both matched, which is just another Humana upgrade. So the Humana upgrade reads the same as the Aetna program. So Medicare covered services after the cataract surgery are a zero copay, but then they're going to give you a $100 allowance to be used every 12 months. So that's an enhanced benefit from what we have today. Hearing evaluations are subject to deductible and co-insurance currently under the Classic Blue, and under the PPO, it's a $10 copay. Under the Excellus plan, it's covered with 100% after Medicare, and under the Humana and Aetna program, it's a zero copay, one eye exam every 12 months. Hearing aids currently are not covered under the Excellus plans and under the Excellus Medicare plan. But under Humana and Aetna, this is another Humana upgrade. Humana and Aetna, they're going to allow you a $600 allowance every 3 years. So this is an added benefit for you and an upgrade for Humana. The next section we talk about is inpatient services. So for inpatient hospitalization, inpatient substance abuse, and inpatient mental health, that's all paid 100% covered on both of our current Classic Blue and PPO plans. It'll be covered the same way under the Excellus Medicare plan, Humana, and Aetna, all covered 100%. Under the inpatient physician visits, same thing. They're paid in full under the Classic Blue plan and the PPO, and would be paid in full under the Excellus plan and Humana and Aetna. So there are no differences under those categories. The next section is skilled nursing. It's covered in full under the Classic Blue. Under the PPO, it's covered in full up to 120 days. Under the Excellus Medicare plan, it's covered in full up to 100 days. So that's our first negative we see. It's a difference. Under the Humana section, it currently says 0 copays for 1 through 100 days and then pays nothing after that. That's been upgraded. So now it reads it's a 0 copay for unlimited days within the benefit period. So Humana and Aetna are the same. So that negative that was there with Humana is now going to be the same benefit as the other carriers. Emergency room and urgent care visits. Emergency room is currently covered in full under the Classic Blue and covered with a copay of $50 under the PPO plan. Under the Medicare Excellus plan, covered 100% after Medicare, and under Humana and Aetna, it's a 0 copay. So the benefits are going to be as good or better. Urgent care visits, subject to deductible and co-insurance under the Classic Blue. Under the PPO, it's a $10 copay. Under the Excellus Medicare plan, it's 100% coverage after Medicare. Under Humana and Aetna, it's a 0 copay. So that section there is going to be as good or better. We did have a question earlier regarding MRIs and CAT scans, and we're looking to get some further clarification from Excellus currently and these carriers to kind of specifically lay out the process. The process is slightly different, and we're going to specifically basically just lay out how it currently is being done now with Excellus, and then how it would be done with Humana or Aetna, and then we could submit that to the district, and it can be posted on the website as well. Next category is outpatient benefits. Outpatient surgery. Outpatient surgery is paid in full under the Classic Blue. Under the PPO plan, it's a $10 copay. Under the Excellus plan, it's on the Medicare plan, excuse me, it's 100% coverage after Medicare. And under Humana and Aetna, it's a 0 copay. So as good or better. Office surgery, deductible and co-insurance for the Excellus plan. Under the PPO, it's a $10 copay. Under the Excellus Medicare plan, it's 100% coverage after Medicare, and it's a 0 copay for Humana and Aetna. And you can see the rhythm here. Under the Excellus Medicare plan, it's pretty much going to be covered 100% coverage after Medicare, so it's 100% coverage. And under Humana and Aetna, it's 0 copays. Somebody did ask me, I think in the very first meeting, what's the difference between a 0 copay and 100% coverage after Medicare? And the answer is nothing. They mean the same. It's just a different way that Excellus words how they cover benefits under a Medicare sub-policy and how the Medicare Advantage plans word how they cover benefits under their policy. So wherever you see 0 copay, that means you pay 0 copay at the time of service for that service. Wherever you see it says 100% coverage after Medicare, it means after Medicare pays their portion, they pay 100%, leaving you with 0 out of your pocket. Outpatient surgery, office surgery, and diagnostic lab and testing. Paid in full under the Classic Blue for outpatient surgery. It's a $10 copay in the PPO. Under the Excellus plan, it's 100% coverage after Medicare, and it's a 0 copay for Humana and Aetna. Under office surgery, it's deductible and co-insurance on the Classic Blue with a $10 copay under the PPO plan. Under the Excellus Medicare plan, it's 100% coverage after Medicare, and under Humana and Aetna, it's a 0 copay. Diagnostic lab and testing, paid in full under the Classic Blue, and under the PPO plan, it's a $10 copay. You can see under the Excellus Medicare plan, it's 100% coverage after Medicare, and then 0 copays for Humana and Aetna, which means that section right there is going to be as good or better as what we have in place today. Next page gets into radiation therapy and chemotherapy. Both of those are currently paid in full under the Classic Blue plan. Under the PPO plan, they're a $10 copay. Under the Excellus Medicare plan, they're also 100% coverage after Medicare. And under Humana and Aetna, there's zero copays. So both are going to be as good or better. Outpatient mental health is subject to deductible and coinsurance under the Classic Blue. Under the PPO plan, they're a $10 copay. Under the Excellus Medicare plan, they're covered 100% after Medicare. And under Humana and Aetna, there are zero copay. So as good or better. Alcohol and substance abuse, paid in full, 60 visits per calendar year. Additional days may be available. Under the PPO plan, covered in full. Under the Excellus plan, it's covered 100% after Medicare. And under Humana and Aetna, they're covered with zero copays. The one thing about the Excellus Medicare, Humana, and Aetna, you do not have to worry about a number of days visits. So they're going to be as good or better. It meets the PPO and is a little bit better than the Classic Blue. Next category is other services. So we have therapy such as physical therapy, speech therapy, occupational, pulmonary. Typically right now that's covered with deductible and coinsurance. Under the PPO, it's a $10 copay. Under the Medicare Excellus plan, it's 100% coverage after Medicare. And under Humana and Aetna, you can see it's a zero copay. Diabetic supplies and equipment education, currently covered under subject to deductible and coinsurance. Under the Classic Blue, under the PPO plan, it's a $10 copay. Under the Excellus Medicare plan, it's 100% coverage after Medicare. And with Humana and Aetna, there's zero copays. Under the Humana section, you can see it says include supplies for monitoring blood glucose. That goes back to Humana and Excellus as well. They all do that. Durable medical equipment, subject to deductible and coinsurance under the Classic Blue plan. Under the PPO plan, it's a 20% straight coinsurance. Under the Excellus Medicare plan, it's covered 100% after Medicare pays their portion. And under Humana and Aetna, it's a zero copay. So those, again, that section's all going to be as good or better. Prosthetics, currently covered under deductible and coinsurance under the Classic Blue, no calendar year maximum. Under the PPO plan, it's a 20% coinsurance with a $15,000 a year calendar max. Under the Excellus Medicare program, it's 100% coverage after Medicare and a zero copay for Humana and Aetna with no max. Home health care, paid in full, 60 visits per year with additional $325 for enhanced benefits. Under the PPO plan, oops, someone needs to mute. Under the PPO plan, it's covered in full, unlimited visits. Under the Excellus plan, it's covered 100% after Medicare. And under Humana and Aetna, they're covered with zero copays. So those benefits are going to be as good or better. Hospice care, currently paid in full up to 210 days under the Classic Blue plan. Under the PPO plan, it's covered in full with unlimited days. Under the Excellus Medicare plan, it's 100% coverage after Medicare. And under Humana and Aetna, they're both zero copays. Dialysis, currently paid in full under the Excellus plan. Under the PPO plan, also paid in full. Under the Excellus Medicare plan, they're 100% coverage after Medicare and zero copays for both Humana and Aetna. Acupuncture currently is not covered under any of the Excellus plans, nor would it be covered under the Excellus Medicare plan. It is covered under Humana with a zero copay for both Humana and Aetna. Next page. Top of the page, we've got international coverage, like we were talking about before. I have TBD there, but we know that with Excellus, any emergencies outside the country are going to be covered as any other services, so we don't see any issues there. Under the Excellus Medicare plan, emergencies are only covered within the first 60 days of travel, and they're subject to a $250 deductible with a 20% coinsurance with a $50,000 lifetime max benefit. So that label is a negative. Under Humana and Aetna, it's going to be a zero copay for emergency services and urgent services outside of the country. So that's going to match what we have in place with Excellus. Under the lifestyle benefits, the Excellus plans don't currently have those, and neither does the Excellus Medicare plan. Humana and Aetna have what we call the Silver Sneakers program. A lot of retirees ask about these programs. It's a gym membership program across the country. They can join as many memberships as they want. Aetna calls it Resources for Living. Both of these carriers have several discount programs for seniors based on different things that they want to do and reward programs. So there's a little bit of an enhanced benefit for you. The next category is prescription drugs. And like I said earlier, people on the Classic Blue have a 210 drug card. So you pay $2 for generic drugs, you pay $10 for name brands. You can see there's a discount there if you get a 3-month supply. And there's an annual deductible of 0, and there's no out-of-pocket maximum. Under the 51530, you pay $5 for generic, 15 for preferred name brands, and 30 for non-preferred name brands. There is no discount for a 3-month supply. There's no annual deductible, but there's an annual out-of-pocket maximum for prescriptions of $3,000 for single and $6,000 for family. Under the Excellus program, they match the 210 like we have in place now. We do believe that they'll match the 51530. We just haven't seen it yet to be put on the spreadsheet to be able to allow both programs to go together. Under Humana, they definitely match the 210 to match what we have in place now. And we also have the 51530 to match the program we have in place now with the discounts. Under the Aetna program, they did a 210 as well and a 51530. One thing I want to point out here is there was a question earlier, I forget what meeting it was. Anybody that's currently on a 210 prescription drug program would stay 210. We're not trying to change anybody's prescription copays. So the 51530 only applies to the people that are on the 51530 currently. So don't think for a minute that we would be trying to change anybody's copays. Whatever copay you have in place now will be the same copay that you have in place, in a different program. Now, before we get to the prices, I want to just talk about a couple things. Some people had mentioned that they think that Excellus would cover their deductible and part of their co-insurance, what we refer to as COB in the business, which is coordination of benefits. And if that is happening for some retirees, that's fine. Doesn't really change our analysis because the benefits are going to be as good or better still. They're going to either meet it or exceed it, so it doesn't change the level of the analysis. The other thing that I also want to mention is the district came to us and said that if any unforeseen expenses would be denied that would have been covered under the Excellus program, they're willing to self-insure. Now, please keep in mind, we do understand that has to be negotiated. It has not been negotiated yet, so we don't have the terms of that arrangement, how that would work or how long that would work. We do know it would have to be negotiated. It's something the district was willing to do and have considered this an extra layer of protection for the retirees. Now we get into the rates, and a lot of people have made comments they didn't really realize how much the district pays for insurance because they only see what they pay themselves. And under the Excellus program, you can see a single plan is $813.92 per month per single. That's the gross monthly rate the district pays. Under the family coverage, it's $2,035.97. Under the PPO plan, you can see that the rate is $759.85 and $1,885.81. Those are the individual rates for the district that they're currently paying now on a monthly basis. Under the Excellus plan, the single rate would be $489.54. And under the Humana plan, you can see it for the 210 plan, it's $305.19. That's been updated because I think because of the upgrades, the rate did change a little bit, went up a little bit, and it would be on the website from the district. Under the Humana plan for the 51530 would be $251.64. Under the Aetna plan, $369.19 and $337.78. And the family rates for any of those plans, whether it be Excellus, Medicare, or Humana or Aetna, you just double the single rate, and then you would get your rate. So when you look at it, you can see that Aetna is at $1.9 million in savings, and Humana is $2.1 million. Excellus is $1.5 million. It's a lot of money. Another question that got asked to me is, well, how much of that savings is going to go to the district and how much it would go to the retirees? And that really depends on the percentage. So if the average retiree paid 10% for their coverage, then 10% of that savings is going to the retirees, and 90% of that savings would be going to the district. So the district is going to get a majority of that savings because they are paying a majority of the premium. Another question that got asked to us as well was, is the district looking at this as a short-term solution or long-term solution? What happens? Are we going to be in this position, 2 or 3 years down the road looking at different programs because, these rates have gone up? So what I did was I took the Humana rates and I conservatively trended them increasing 9% every year, and it would take to the year 2031 to equal our existing Excellus rates today. I then took the same calculation and took the Excellus rates and added 5%, which is conservative as well. And at the end of 2031, the difference between the current Excellus Blue Cross Blue Shield plan and the Humana plan were still a substantial difference. So the answer to that question is, this is not a short-term solution, it's a long-term solution. All of my districts that have already moved in this direction are still there today. Not one of them moved off the plan, off a Medicare plan. They've switched carriers potentially, but they're still with the Medicare plans. I took the liberty of just doing some calculations so retirees can kind of put this in perspective. If a retiree is spending 15% of the premium, and I know two of the retirees I spoke to were paying 15%, it would be $1,465 for a single on an annual basis and $3,663 a year for family. Those are what the retirees would be paying under the current Excellus plan. If I take that same calculation and I go over to Humana, the single rate would be $549 a year instead of $1,465. The difference is $900 a year in savings, and it would be $1,098 for family versus $3,663, which is $2,500 roughly in savings. So there's a substantial savings here for retirees, and there is for the district as well. Did I forget anything, Joe?
No, Ed looks good. I'm sorry, I was muted.
Oh, that's okay. That's a lot of information in a very, very short period of time. And so what we can do now is we can open it up for any questions anybody has.
I think we have one in the Zoom chat. It's from Jillian Kellogg. Does no copay mean that you don't even end up having to pay?
That's correct. Zero copay means you don't pay anything.
And there's a little bit longer one. So Ed, can you see the chat or no?
I can't see the chat right now.
Okay, I'll read to you. These plans as outlines have been tailored to meet current district criteria. I understand the district's intent with self-insurance for yet has an undesignated period of time. What happens to our coverage over 5, 10, 20 years and beyond, particularly when now active employees are ready for retirement? I can't believe that the district would provide the guarantees of the self-insurance over such a long period of time. Basically speaks to the time period of self-insurance, Ed.
Yeah. Well, that's something that still has to be determined, but I think that, I've only had two other districts that had put that out there, and I think they did it I think one did it for a couple of years and one did it for about 5 years. And what they found is the one district that did it had to pay for a pair of compression stockings, which, by the way, are covered under the Humana and Aetna programs. They were under a Medicare sup policy, and they were not covered at the time. And but after a while, they weren't paying for anything, and they were able to talk to people and just not do anymore because everything was being paid like it was supposed to be paid. The other district that did the self-insurance, they basically paid for, I believe it was a podiatrist who was a private contracting physician. So they paid that for either one or 2 years. It was a few $100s. And I believe the employee or the retiree, ended up changing providers. So it's, the question is, I can't believe the district would do this. I think the district really wants to just make sure that the retirees, that they know that they feel this is a good program and will meet the criteria of as good or better as what we have in place today. It was really just an extra layer of protection for retirees, just in case some, I keep asking all the time, what would not be covered? I don't even know. I mean, we kind of went through this with the compression stockings, and now we know under the Medicare Advantage plans are covered. So it's I don't know what would not be covered.
Ed, were you you said earlier that you were looking into a question you were going to ask Excellus and maybe the other two that you're representing about a question that was on the 12 o'clock one. Is that the one that I asked about the pre-approval?
Yes, Pat. I want to get some specific information for you to talk about exactly. I'm going to have it come from Excellus, so it's not my words or my interpretation. So I'm having Excellus put together for me how the wording is today, and how does that medical necessity wording come into play, and then put that next to the other plans, and then there's they're like I say, here's the difference of the process, and so the district can see the difference between the two. So I
Thank
am going
you.
to get, yeah, no problem. I'm going to get more clarification for you. So it's just a little bit more clearer.
We may not be on the same page, but I just guess I want to say, because I know there's some new people on that have been talking to me about it, that means, my question was, is it going to be in writing that we don't need pre-approval? Because right now you do not need pre-approval with our excellent healthcare insurance. And I also just wanted to, because I had a couple people reach out to me since the last meeting, and they just asked that maybe to educate ourselves, go on YouTube and check out Medicare Advantage plans, explain 2020. And there was one more that was Medigap. So some of those things they're hard to understand, but if you wanted to do that to educate yourself, that would be fantastic. And I just want to say thank you for checking out that other question I asked.
Yeah, no problem. I think that, when people go online to look at different things, they need to just make sure they're looking at a group policy, because a lot of the information on the line, on the web, are about individual policies, and they talk about out-of-pocket expenses and deductibles and co-insurances. So it is confusing potentially to try to review that online, but certainly make sure that you're talking about the group policies. Just like when earlier, I think somebody talked about they had called a hospital, they weren't part of the network, but they would take if they were part of the passive program. So that does apply. It's just people trying to get used to different different languages of the terms. So
yeah, and I guess too, to educate people, and guys, I'm getting educated at the moment as we do this, so I certainly don't know a lot about this, but I was just told that the new one is not an indemnity plan, but a supplemental one, and we currently have an indemnity plan. So I'm not sure exactly what that means. If you want to explain it, it's just
an indemnity plan means you can use the doctors that you want to use. So we get into a Medicare supplemental policy as a supplemental policy, but if your providers are accepting Medicare or do Medicare assignment, which is 98% of the people across the country, there should be no issue. Same thing with the Medicare Advantage policy. So, an indemnity policy means, you can use anybody you want. And then if you use a provider that's not part of the network, that provider can balance bill you, and you get into different things like that. Under the Medicare policies, if a provider does not accept Medicare, they do Medicare assignment, they have the right to charge 15% more than what Medicare would normally reimburse. But those fees or charges are all paid by all the Medicare carriers. So again, that would be something that would not really apply to the retirees. So the thing is, I think I mentioned earlier, Pat, from a national standpoint, because retirees are all over the country, 98% of the people participate with Medicare or Medicare assignment. Under the Blue Cross plans, 98% of the providers in our 31 counties will take Excelis, but on a national level, it's 80%. So there's more providers to choose from on a national basis than what we have with Excelis currently. And that's an Excelis statistic, not ours.
Thank you.
Vicki Quatler, can you hear me?
Yep.
Yes, I'm interested in knowing what will be the delivery system of the information that you receive from Excelis. I'm fairly certain you're not going to be able to secure that by this evening's town hall meeting. So how can we expect to receive that information and then be able to ask questions or make comments in regard to the information you secure?
So the information we secure about, well, I guess I'm not sure.
Just said that you would be connecting with Excelis, Blue Cross Blue Shield to get clarity on some things.
Oh, yes.
What will the delivery system be?
Yeah, well, once we have the clarification from Excelis, we will then send an email to the district, and they'll put it on their website to post it. And I wouldn't really anticipate this taking more than a couple of days. So Excelis has been good to get back to us, and we've got Humana and Aetna answering questions for us. So we're trying to get clarification out. I know that we're trying to get a finalization of the skilled nursing question that came up initially one of the first meetings, and then we're also going to try to finalize the pre-certification of MRIs and CAT scans. And we've got some information from Excelis already, but we asked, that just gave us information to ask more questions. So we should have that very soon.
Right, so the idea will be that it will be put on the website, but if we have questions or we would like to make comments,
Yep,
what would
absolutely.
be the stage for that?
Yep. My email address and my phone number are on the website as well. So if you have any further questions, you can email me your question, and we can get that forwarded to Aetna or Humana to get them answered and get back to you. And the ladies at those companies have done a very good job, I think, getting back to people with answers. So any further questions can be directed via an email, and we'll get right back to you as soon as possible.
And would there be a plan to have another town hall meeting once that information is secured?
I think we have one more town hall meeting, which would make 9. And I think at that point, after that, any questions that come up would probably be via email. Joe, what are your thoughts?
I'm okay with that, Ed. I mean, if we have to, Vicky, that's something you and I could discuss. If you feel that we need one more.
Well, I think it would be important for, the information would be in print, but if someone had a question or needed clarification for any of the information, that might be helpful.
Well, we can certainly arrange, if you think it's needed, another meeting to just go and answer questions. So if you think that we need to, once we get all this final information out to the district, if you feel that we need to just have one more meeting to be able to answer questions in this public forum, we certainly can do that as well.
Vicky, you're not saying another presentation and do everything that Ed did today. It's more of a Q&A, am I correct?
Correct. I'm not saying a presentation. I think there have been, there have been 9 opportunities, but after reflecting, you might have some people that are new today, maybe some people that will be new this early evening, and with that other information being made available, I think it would be a good idea to have another opportunity for questions and comments. Yes.
Sure.
Okay. The other thing I want you to know, Vicky, too, that all these are posted out to the website. So if someone missed one, they can go back and watch the presentation.
That's true as well. Thank
Yeah,
you.
I don't know. Right, I didn't know, Vicky, if I said that earlier, but I mean, yeah, we did take every question that was brought up in these town hall meetings, and we listed them and put the answers down and got them back to the district as well. So if you didn't come to every meeting, you wouldn't have missed the questions.
Right. Okay, thank you.
Vicky,
Yes.
are you asking about the Excelis Medicare supplemental plan or about the Excelis Classic Blue that we have now?
I'm asking that there were some comments made earlier in this presentation in regard to Excelis Blue Cross Blue Shield, so I wanted clarity on that.
Right,
Okay.
clearly on the pre-certification on the like MRIs and CAT scans, we're in the middle of getting that now, which really just compares what we currently have in place now to the Medicare options, and just to have more information on it.
Correct.
Yep.
Ed, Linda Roby's had her hand up for quite some time. If we can go to her quick.
Oh, sure.
Okay,
Hello, Linda.
Go
hi.
ahead, Linda.
Hi. I'm looking at my chart. I'm looking under prescription drugs. So one question, do we have a maximum with this new plan of drugs money that we're allowed to spend? Is there a maximum?
No
Okay.
maximum, Linda.
What's that?
No maximum at all.
Okay, and then when I'm looking over at the Humana column, what is that second column that says $3,000? I don't know what that is.
So what that is, Linda, on the bottom of that column, under our classic blue plan that you have currently, you would pay those 2 co-pays forever. So if somebody had a lot of co-pays, you'd pay them forever. Under the PPO plan, you have what's called a 51530, which doesn't apply to you. But if somebody had a lot of prescriptions as an individual, once they've met $3,000 in co-pays, then there would be no co-pays for that person the rest of the year. So that $3,000 only applies to the 51530 plan. I believe you're on the 210 plan, aren't you, Linda?
Right, I'm on the first column. the
Yeah.
classic
So
blue.
the 3,000 wouldn't apply to you, but just so you know, so I want to make sure I answer your question. The $3,000 is the out-of-pocket max for those people that are on that plan that they'd have to pay in a calendar year in co-pays. You'd have to spend $515.30 and equal $3,000 in co-pays. Before then, you had 0 co-pay for the rest of the year.
Okay, it just got me thinking, is there a maximum allowed? And
Yeah, no, good question. No, it's a good question, but no, the
Okay,
answer is no.
I do have a question about getting second or third opinions. You know, say I go locally and I'm told I have X, Y, Z, and being as thorough as I am, I might want to go to 2, 3, 4 places to hear about other opinions. Is that permissible? I mean, it is now. I know that, you know, we've done that.
Yeah.
We've got.
Cindy, you want to address that, Cindy?
There's no limit on that. If you'd like to go to a doctor a day, that's fine. There's no limit on the number of second opinions.
Okay, so you could take that same diagnosis and go wherever you want and,
Yep.
you know, out of town and get opinions.
Yes.
Correct.
Okay.
Yes, ma'am.
Okay. What about comparing specialty pharmacies? We didn't really talk too much about comparing specialty pharmacies to what the specialty pharmacies are now and the 2 separate plans. And maybe that's like not specific enough, but
Well,
yeah.
it's not specifically enough in that, Linda, that each carrier has their own specialty pharmacy. Excelis has, I believe, a Credo, and then Humana has, I believe, their own, Cindy.
Yes.
And
Yes,
then
we
Aetna
do
has
have
their
our
own.
own Humana specialty pharmacy, but we also contract with some independent pharmacies as well to administer the specialty drugs. So that's why I was just looking up each one of them.
Right.
That what we have and it sounds great.
I've had personally an instance where Medicare would not cover my husband's CPAP because he wasn't bad enough for them to cover it. So then the doctor that we were at, I said, well, send it to my secondary. And he said, well, if Medicare doesn't cover it, your secondary most likely will not, because I understand the Medicare's primary. If you don't meet the rules of your primary, your secondary won't cover it. However, Blue Cross Blue Shield did cover it. Now, I'm not that concerned about that one particular instance because I would have bought that anyway if I had to pay for it. What I'm more concerned about, if it was something really major, which I can't even make up what that could have been, but that, you know, it's like something we can't compare because I don't know what it could be. But just because there was that particular instance, it concerns me what could happen. What if it's something experimental? What if it's something, you know, I don't even know what to make up, but it's more the theme of what happened.
Well, it's the fear.
Okay.
It certainly is. I get your point, Linda. It's the fear of not knowing. And sometimes the fear of something like that is worse than what we're actually talking about, because it's hard for us as well. As people ask us, like, so what's not covered? And as I sat here in every meeting, told people, we do not get complaints on these plans from any of our school districts. We certainly get phone calls, and we do have some things that sometimes get miscoded or claims will be incorrect. But you have that with any carrier. But we don't get complaints from people that will say, oh, this is not covered, or that's not covered, or I couldn't do this. We don't have a provider. I was asking Kristen in between our meetings here, I can't remember the last time somebody called to complain about one of these programs not doing what it's supposed to do. And it really is just more of we're here as an advocate to help people answer questions and educate. And if there is something that was paid incorrectly, our job is to get it paid correctly. So it's hard for us too, Linda, to say, what wouldn't be covered here. And then also, as Cindy said earlier, as Medicare improves their plans and says, we're going to cover more stuff, these plans also have to keep upgraded with Medicare to cover those as well. I think she used she said if Medicare ever, what was it, acupuncture, although you have it now in your plan as an extra benefit. But, if Medicare put acupuncture in, then the Excelis plan would have to cover acupuncture as well.
So maybe I'm kind of repeating almost what you said, or maybe you answered this already, but I looked up some glossary of terms. And so a non-covered procedure of service, because I was looking at a hospital site just to kind of get educated. And it said that a medical procedure or service that an insurance plan considers medically unnecessary or experimental and therefore does not cover. That's just a general term, non-covered procedure of service, but we're not comparing those. We're not comparing like what Humana would consider experimental or not covered, and what we now would consider what's experimental. Again, you're right, it is the unknown, but we're not talking about any of those.
Well, I think the process, Linda, like as we talked about earlier, I think Cindy mentioned that, Humana can cover experimental procedures based on notes. Even Excelis, our current plan will tell you, we have an email from Excelis. We don't cover experimental procedures. However, right, things can be, we can go back and try to reapply, and you can go back and appeal it, right? And so a lot of those things based on medical necessity, if something is really needed, we can fight that. And that's kind of where our call center comes into place. I mean, and if it's an appeal situation that comes up, we can certainly appeal with the retiree to help them through that process. But it's a similar process that we have currently with Excelis now. I mean, certainly they would tell you in their language, things that are not FDA approved or things that are experimental are not typically covered. You can go through an appeals process and see what happens, and we can win some, no doubt. And same thing with Humana and Aetna. There's an appeals process, and I think Cindy alluded earlier, we can cover some things that are experimental. So it's hard because those experimental things pop up every day, right? Things that were experimental that are now deemed FDA approved, they're fine, or there's different experimental drugs or procedures that were before that they don't use anymore. It's a constant changing atmosphere back there. So it's kind of hard to pin that down and to try to say, other than the procedure itself to appeal something that's experimental is very similar.
And what about the usual, customary, and reasonable wording? Will a center will we be reasonable with these new programs with what is considered usual and customary? I mean, okay. And then what raised a red flag to me is this new talk about MRIs and testing. I know in the past, obviously, anything that was needed was just like quick like that. You go to the emergency room, they say, well, let's do a CT, and it's just like fast, and that happens. So I'm not even sure what we're questioning.
Well, what we're questioning, Linda, and Pat's got a good point in is fact that it's the process. Currently, there's not a request that you have to get a pre-authorization to get a CAT scan or an MRI. Now, under the existing language, it does say that the benefit has to be medically necessary. So if a physician does a CAT scan or an MRI and Excelis deems that it's not necessary later on, it becomes the retiree's responsibility. So it can be rejected according to Excelis. Under the Humana plan and under the Aetna plan, all that has to happen is the doctor can make a phone call into the carrier to get the pre-authorization. And as Cindy said earlier, and if, like you just said, if you're in an emergency room and want to do the CAT scan right then and there, so right, that doctor can make that phone call right there and rush that approval through and get it done right there as well. So really, just so in just my opinion, and I'm going to get more clarification for this. What I think is happening is in one situation, we're just doing it, and then the approval comes at the end, and it could be denied potentially. I'm not saying that they are, but Excelis knows that they have denied some in the past. With Humana and Aetna, the approval comes up front, and then the retiree would not have to worry about a denial later on. So it's a physician thing. It's done behind the scenes. And if somebody has to have one done quickly, and I will tell you this, facilities and physicians, hospitals, they know how to work the system. When they see the plan that people are on, they know how to make sure to get stuff done. If I'll tell you right now, most doctors will not do an MRI on somebody if they think for a second that it might not be covered or that person might have to pay for it. So they want to make sure that it's going to be approved, and most are. I forget, and I think that's why Excelis went away from that maybe a few years back. It was probably maybe even 10 years back why they went away from that, because they used to do a pre-authorization as well. But what they found was they approved most of them. So they thought it was a tedious process. With Medicare, they don't take a chance on having retirees have that come in the back end. So they want to make sure that the doctor makes the phone call, and they can do it as soon as possible to get that done as soon as possible, and then just get it done. So I'm going to speak to Excelis and make sure we have exactly how the process works and what are the obligations and liabilities, and then how does this work with Humana and Aetna? We'll put that together and get that down to the district.
Thank you.
Okay, Sally's had her hand up forever, Ed.
Okay, Sally.
No, not forever. I wanted to know, you were talking about appealing things, and I wondered if you guys at ENV have done many appeals.
We haven't needed to. I think, and I could ask my call center. I want to say in the last 25 years, when it comes to these Medicare programs, we may have gotten involved in about 5 appeals. It's not been a lot. Cindy, I mean, how often? I mean, you probably see a lot more than I do because you're national and but I mean, do you see a lot of appeals?
I don't, because I'm not on that end of it, but I can pull the statistics to see what kind of numbers we're looking at.
Okay, if someone asks you to appeal, do you usually go and appeal, or do you discuss it with them and decide whether or not you should?
Yeah, we work with you, and we will help that person put up whatever paperwork together, whatever doctor notes together that they need. So we will help them through the process of appealing. I think that was a situation. I think in one of our first meetings, Joe, somebody talked about somebody that they knew they were going through a process and they were doing it themselves. They had nobody to help them, so they didn't know what to do. And here's a perfect situation where our call center could have helped that person. And then also keep in mind, we have 2 people in my office that are CMS certified, which all they do all day long is work with post-65 retirees to help them with any questions, or they do a lot of individual plans as well. But they've worked with people in the past on appeals as well. But I don't really see that we've had to appeal much in a long time.
Thank you. I have one more question though.
Sure.
If you're in the emergency room and you need a CAT scan, the doctor still needs to call Humana or Aetna or somebody and say, I need this CAT scan on this person before they send them out.
Cindy?
No, I'll jump in on that one, because 2 weeks ago I was in the emergency room, had to have a CAT scan on my knee, and they do it immediately for the emergency room. So emergencies are different. Then they did suggest that I have an MRI. I waited a couple of days because I knew the process had to be approved. Now I'm not on a Medicare Advantage plan, but I'm still on my active plan, and I knew that it had to be approved. So I did wait a couple of days before I went forward with an MRI. But in an emergency situation, no, there's no authorization that needs to take place.
So even Cindy on the Medicare Advantage plan, if it's an emergency situation, that doesn't need to take place.
No, it does not.
Thank you.
Okay,
Thank
that's good.
Any more questions?
Joe, I'm going to bring up the one that I had prior to regarding one of the people that is currently an active employee. Are you hearing me?
Yep. Yes, ma'am. Yep.
All right, so we have an active employee, and the employee is 65 currently. They are getting ready to retire. In the fall, the employee had a family policy. When doing the retirement planning, they found out that it was going to be so expensive to have their spouse on the insurance post-retirement that the spouse took another individual policy through their employer. So currently right now, the employee is only on an individual policy. When the employee goes to retire, now if we do switch as of July 1 or whatever date it's going to be, will that employee, current employee, have the opportunity to go back to a family policy to allow their spouse, or is there a qualifying event currently that would allow that spouse to come back on, so that when this person does retire, they would be able to take advantage of this plan?
From our standpoint, Kathleen, it's really a district policy. I mean, if the person wants to come on as a family, once you make the move, the employee and spouse, that would be fine. The Medicare Advantage companies wouldn't care.
No, and in fact, that's one of the questions that we'd asked during implementation. Do you want to have an open enrollment annually and allow that annually, or do you want to just do it the first time? Do you want to do it at all? It's entirely the district's call.
And Mrs. Cront, I believe July 1st would become an open enrollment period. She could change it. He or
She
she.
can,
Because you would go back to an open enrollment period on July 1st.
but as of July 1st, she'll already be a retiree.
That's fine. I mean, if they,
What about it?
people are asking for one. Is that something you can do?
A review of the current plans?
Yes.
Yes. I mean, what else, what do they want to have reviewed?
Sally, you asked a question in the chat. What more would you like? Where'd Sally go?
And we can certainly have Excelis. I think we typically do have the carriers review what we put on an analysis to make sure we didn't miss it. And that's why if you look at the initial spreadsheet, we had some red and some black, and the red was stuff that we did not have on your summary. So I believe Kristen Wall had confirmed with Excelis how those benefits were done. Is that what we did, Kristen?
Actually, no, Ed, we didn't. We just went based on the summary that the district gave us, but we can certainly send that over to Excelis and have them confirm the benefits as we put in red.
So we can certainly, Joe, if they want that, we can have Excelis review what we listed as their benefits just to confirm that what we have on there is accurate. I'm fairly confident that it is, but if that'll make somebody feel better as well, we can certainly do that.
Is Sally still out there?
Yeah, Sally's still on. She's just muted right now.
Okay. Sally, I have a question for you. Are you asking for what Blue Cross and Blue Shield used to put out, which was a benefits portfolio booklet? Is that what you're looking for?
Yes, I was looking for one of my own and I don't find it anywhere.
Yeah, they stopped putting them out, I'm going to say probably about 7 years ago.
Oh, that's why I can't find it.
Yeah.
Well, the ACA, what they did is they came up with the SBCs, which are the summaries of benefits and coverages, which are all supposed to be the same with different carriers so people could compare. So you should have an SBC.
What's an SBC?
It's a summary of benefits and coverages, which would list all your coverage, kind of like that old portfolio did. Just it's a different format.
I can tell you I have not received that in years. You know, on an annual basis, you used to get them, the booklet, the portfolio book.
I think Excelis just puts them online. So if you set up like my, was it, Kristen, my Blue or my Excelis, your own personal portal, it's all
if you just go to excelis.com, you can sign up as a participant. The summary of benefit and coverage, it has a lot of good benefits. It doesn't encompass every single benefit that we did. We have a pretty comprehensive list that's on Ed's sheet here. The summary.
That's pretty extensive, right?
Right. They don't list every benefit, but so just to clarify that for you.
And I'll jump in and say Medicare does require us to print a booklet and send it to each and every recipient within 30 days after the effective date. So you will be receiving books, whether you want all that paperwork or not, but you'll receive a document from us or Aetna every year.
Did Sally get that information?
Yes, thank you.
Okay, Sally. Anything else?
I would just like to go off of Vicki Quatler's comment about having another meeting. I think it's great that you're putting those in writing and answering questions, but that doesn't provide the forum for everybody to get together and be able to ask questions. Yep, we can email you, but those responses don't go out to the general public. And with this being so important, I think that it would be worth rescheduling if that's what other people would like to. So thank you.
And Pat and Vicki, let me understand, you just want a Q&A, not another presentation. Vicki, you said 9 is plenty, just a Q&A?
Yeah, definitely not another presentation. And I also just read your chats on my computer too. And I think that what I would like to see, because other people want it, and I know this has been talked about before, is that a representative from Blue Cross Blue Shield, who is an expertise at his company, come in and give a presentation, because he's going to be able to he's going to try to say, hey, this is why you need to stay with this. And I guess this is maybe, is there a possibility? Has anybody reached out to Blue Cross Blue Shield and say, you know, can you give us a better rate, or is that because it's the consortium and we don't have a say in it?
The consortium is a group rate that's already negotiated, so we can't negotiate outside the consortium.
Okay.
You're absolutely right, Pat. I mean, that's a good point, Pat. I mean, being the consortium, you know, it's like being part of any association. You're at the mercy of what they have for benefit plans and what they have for rates. And so there is no, like, Excellus can give us a program. Whereas if somebody is outside the consortium, they have the ability to negotiate. Now, the theory behind consortiums is the more people, right, the better risk. And then all of a sudden you have, you know, you're buying with a group policy, so you're getting better buying power. And so that's why you see, from a national standpoint, Humana and Aetna have better rates than Excellus, because Excellus is a local company. Excellus is not a national company. It's a 31 county company, part of the Blue Cross Blue Shield Association nationwide. Humana and Aetna are national companies.
I guess it's kind of interesting though, and you know, you have to be very fluent in this knowledge of this insurance though, but if Blue Cross is losing school districts or companies, I would think that they would be coming out with something. That maybe that's a silly comment. I don't know.
Not all companies are making a lot of money, or they hold a lot of stock in Medicare products. I'm not saying it's meant to Excellus's position. Excellus believes that they've got a competitive product in their Medicare sub policy, and you know, so, and then from the individual side, Pat, you know, Excellus is the 2,000-pound gorilla in our area, right? I mean, from an active standpoint, not many carriers can compete with Excellus. We have some of our schools are self-insured. We have some schools that are with different carriers, but not many. Most of our districts are with Excellus from an active standpoint. However, a lot of the schools that have moved away from Excellus, only one district that I had ever stayed with Excellus from a Medicare side, and that was the Shenango Valley side for their non-instructional. Everybody else went to either Hartford, Humana, or Aetna.
Okay, thank you.
And just to bring that part up, if you look down at the bottom of the very last page, when you get into the pricing, okay, so currently right now, Excellus Blue Cross and Blue Shield and Excellus Blue Cross and Blue Shield with the PPO, their prices are more than double what even their Excellus Medicare supplemental plan would be.
Right.
So they already know upfront that they're overcharging, but because they're in the group policy with the consortium, they get away with that. And that to me is, as I said before, unconscionable. Humana, on the other hand, it is a little bit more than the Excellus Medicare supplemental, but its coverage seems to be much more in depth.
Well, one thing too to consider, remember, is that the district itself, because you're part of the consortium, Excellus looks at the consortium as the client, not the individual schools.
Correct.
So people don't realize that. You're not negotiating with Excellus at all. You're part of a consortium, and you have a seat at the table for that consortium. The consortium is the client.
Kathleen, this is Kristen Wall from ENV. I just wanted to comment on your, when you're looking at the Excellus rate, you've got to add the medical plus the prescription rate. So just when you're looking at it, so it's $489.54 for Plan F. So I just want to make sure you're adding both of those. So that's actually more expensive than Humana or Aetna.
Right, on the med sub, you've got to add the prescription and the medical together. Under the Medicare Advantage,
That's right. Yeah,
it's already all there.
So that's still more than.
Still a big difference, yes. Yep.
Yeah. It's still about half of what they would charge otherwise, though.
So going back to Pat's original, I think the basis of the question is, can we go back with Blue Cross Blue Shield and negotiate in the consortium? And the answer is no, Pat, we can't.
Yep, that I forgot about the consortium bit. But what about a Blue Cross rep coming and explaining their side of the thing, like you've heard from other people in the chat, not me, but other people wanting that?
I mean, they can come in and do that, Pat, and I'm sure I could find one, but the prices aren't going to change.
I don't think it's just about the price. I think from the comments in the chat I think that person can say they can try to sell their program. They can try to say, this is why you should stay with Excelis, and this is what, here's a hidden thing that you didn't know about or you didn't think about. Because I've gained so much more knowledge by just attending the meetings and things I don't know about. And I'm just piggybacking off of the chat comments, so.
Pat, when we're talking about Blue Cross and Blue Shield or Excelis Blue Cross and Blue Shield, when we're talking about under 65 is when it's the primary. Post 65, it's the secondary insurance, and they follow Medicare. So it's whether they show you or try to keep you at a rate that's more than double the price, they're not able to give you that much more to validate more than double the price per month per individual or per family.
Kathleen, I'm well aware of the under 65. I get that. But again, it's just mind-boggling to think that I know they're more expensive, but right now we are so lucky under the 65 age to have what we have. And that's partly why we pay more money for it, because it is an excellent plan. And I guess I think I'm reading through letters that I've read and comments from retirees. It is a very scary thing. We know what we have. We know it is excellent. And what I've read, they don't want to switch. So I guess I'm just going to go back again. It's not Pat saying this. It's in the chat. Someone is asked, can a Blue Cross Blue Shield rep come and give their spiel on theirs? So I thank everyone for listening.
Thank you, Pat. Linda Roby, you have your hand up again. Where's Linda? Linda, go ahead. Linda, you're muted. I can't unmute you. You're gonna have to do it.
Sorry. Okay. I understand about the active employees and the over 65 and what Excelis Blue Cross Blue Shield means to each. And as someone using it as a supplemental to Medicare, it has been excellent, and it has covered when Medicare has not, and it's been very lenient, and a lot of us hate to lose it. So therefore, it makes all the sense in the world to me, and would be a source of comfort to me to hear somebody from Excelis Blue Cross Blue Shield saying, retiree people, we don't do anything better for you, or retiree people that have us as a supplemental, we do this, we do that. Advantage plans typically don't. I mean, it would be a source of comfort to me to hear them say, you're paying a lot of money for something that we're really not giving you, because I don't know that.
Yeah, like I said, let me reach out, and if we can schedule, we probably can't do 9 town hall meetings, obviously. If we want to do that, maybe 1. If we can do it at a time that we could get everybody on, again, I don't have an issue trying to set that up.
Well, I just don't understand, in a sense, if we're comparing, we're not really comparing, because we're not hearing the other side. And it would be comforting to me if we had to lose that good insurance to hear the other side, or not. Yeah.
I could think we can take and we can have Excelis verify the left columns on the analysis, and I can certainly have them put a recap. I don't know. I guess I don't know what Excelis has never, any of the cases that have left Excelis to go, Excelis really never had any kind of rebuttal to put against somebody moving, because I mean, the price differential and the benefits were there. So I need to speak to Excelis to see what their thoughts are. But I mean, obviously they're biased. They don't want to lose that business for sure. But at the same time, they have to see the districts have to look whatever options they can. So let us see what Excelis has to say. I certainly don't have a problem if Excelis wants to do that, to set up some kind of meeting. But we'll go down the first process first and see where they are.
Ed, will you have time to reach out between now and 6 o'clock to see if you can get an answer? Because a lot of the people are on all the calls. And if we give some type of answer at 6 o'clock, I think their minds might be set at ease a little bit.
Yeah, I'll give Kristen Wall and I will talk after this meeting, and then we'll put together a game plan and see if we can get a hold of Excelis, and then and then at least report that at the next meeting.
Okay, all right. Is that Pat and Vicky? I don't know who else had the question. Maybe Sally. Will you guys be on back at 6?
Yes, but I think that I'm getting text messages as we speak and reading things. I believe that the general consensus from from many different people is that we want an Excelis rep. One that works for the company, one that's going to sell their product. So I'm pretty strong on that right now. And even after I'm reading messages that are coming across my phone. So I respectfully ask that the district, and someone else just came on now about, I think it was Linda Roby saying we need to, if we're comparing, let's have apples to apples here. Let's give Excelis a chance. So I, again, respectfully say that, and I'm off to Zoom one of my kids for a meeting. Thank you, guys.
Take care, Pat.
Thanks, Pat. Sally, you have your hand up again. Go ahead.
Yes, has the consortium recently renegotiated?
They negotiate every year.
Okay, thank you.
And Sally, schools are doing this in the consortium, and the consortium's aware schools are doing this. Remember the sheet that Ed put up. So we're definitely not the first school in the consortium to pull out the retirees.
Right.
Any other questions at this time? All right, we will be back at 6 o'clock, correct, Ed?
You got it, 6 o'clock.
Thank you. Thank you, everybody, for coming out. See you at 6.
Thank you, everybody.